Good day, everyone, and welcome to this class where we'll be talking about infection control in healthcare, the various infections, how they can be contracted, and also how they can be prevented. Beginning with the definition of infectious diseases, we say that they are microorganisms like bacteria, viruses, fungi, and parasites that enter the body and they disrupt the normal functions and activities of the body. Looking at them individually, 1. Bacteria. Bacteria are single-celled microorganisms that exist independently, symbiotically with other organisms, or as parasites that cause harm. We're going to be looking at the parasites in this case. These parasites are very harmful to the human body and they can cause many diseases or illnesses. Going over to viruses, they are much more smaller than bacteria and require living cells to reproduce. Therefore, they infiltrate cells and take over the cell's machinery to reproduce. Example, we can see the HIV causing AIDS. So these viruses, they keep reproducing and reproducing and reproducing, which is very harmful for the human body. 3. Fungi. They include yeast and molds. They can cause infections on the skin or can invade internal organs. Example, Candida causing thrush. Unlike the bacteria and the viruses, they can live in or outside a living thing or a living cell or a living organism or animal or even us human beings. Looking at parasites, they are organisms that live off other living beings. For example, the Plasmodium species, the malaria parasite. This parasite can either live in the human body or outside the human body. Not only human beings that it affects every other animal. The parasites that live in the human body are called endoparasites, and those that live outside the body are called ectoparasites. Going over to infectious diseases in healthcare settings. In healthcare settings, the prevalence and transmission of infectious diseases are of particular concern. High concentration of potential carrier of infection, such as sick patients, invasive procedures that might introduce pathogens into the body, use of antimicrobials can lead to drug-resistant strains, vulnerable populations, example, those with suppressed immunity are at higher risk of infection. Infectious diseases hold a significant role in global health, especially within healthcare settings. It is vital to comprehend these diseases, how they spread, and methods for controlling them to ensure the provision of safe, efficient, and quality health care. Infectious diseases is critical in healthcare settings. Understanding infectious diseases is critical in healthcare settings for several reasons. 1. Protection of patients and healthcare workers. Proper understanding helps prevent the spread of infection, thus keeping everyone safe. That's information. Every worker and patient should be informed, should be enlightened on the spread of infections so that they know how to control or prevent contraction or spread. 2. Quality of care. Reducing healthcare associated infection enhances the overall quality of patient care. That means in the hospital, there should be use of antibiotics to reduce the spread of infection in hospitals or clinics or any healthcare environments. Any place that provides healthcare to patients, any place that treats patients, they should be aware of these things and use them in these environments or buildings. 3. Cost efficiency. Preventing infections can save significant costs related to treatment and extended hospital stays. That is, when these patients and these healthcare workers are informed and are enlightened and they know how to prevent the spread and contractions of these infections from the air or from direct contact with infected things or organisms, it saves them the cost and the fortune of staying and spending on hospital bills and different sicknesses. It saves them the different illnesses that they are going to contract and the bills they will pay for these treatments. Public health. A healthcare setting can be a potential source of outbreaks. Understanding diseases can prevent these outbreaks, and there are more considerable public health risks. It's just like informing and enlightening over and over and over again to prevent these outbreaks from happening. Modes of disease transmission. Disease transmission refers to spreading infectious agents from one source or reservoir to another host. It is crucial to comprehend these modes of transmission for infection control. The primary modes of transmission include: 1. Direct contact transmission. This occurs when there is physical contact between an infected person and a susceptible person. For example, shaking hands with someone who has the flu might transfer the virus. Or another example is during the COVID-19 period, where we were advised to stay 6 feet away from people, as direct contact with an infected person will also affect the person that is not infected. 2. Indirect contact transmission. Contact with a contaminated surface or object can result in infection. For example, if someone touches a doorknob or medical equipment that contains infectious agents and then subsequently touches their mouth, nose, or eyes, they may become infected or they will become infected. So we have to be careful what we touch, what we eat, and how we cook the food that we eat to prevent these infections. For example, if you're going to cook poultry or meat, you should either cook them below 45 degrees Fahrenheit or 7 degrees Celsius, or above 140 degrees Fahrenheit. Anything within this range encourages these bacteria to remain in the food and can cause infection, harmful infection to the individual eating this food. 3. Droplet transmission. This occurs when an infected person coughs, sneezes, or talks, releasing droplets which are then inhaled by a nearby susceptible individual. Diseases like the common cold and flu often spread this way. That is why it is advised for someone who has cough, whenever he coughs, he should cough or sneeze into his left elbow to avoid spreading the disease or infection to another person. 4. Airborne transmission. Infectious agents have the ability to become aerosolized, meaning they can be transformed into a fine mist that lingers in the air for extended periods. This poses a risk, as individuals can inhale these suspended agents even after the infected person has left the vicinity. Tuberculosis serves as an example of a disease that can spread through this mode of transmission. Vector-borne transmission. This involves insects or animals that carry infectious agents, such as mosquitoes carrying malaria. Common vehicle transmission refers to transmission through a common source like contaminated food, water, or medications. An example is lettuce from food poisoning. Another example is drinking contaminated water, which can lead to diseases like cholera. Disease transmission in healthcare settings. Recognizing how diseases spread is crucial for implementing effective infection control measures. By understanding these modes of transmission, Healthcare professionals can take proactive steps to prevent the spread of infectious agents and protect both patients and themselves. Challenges in healthcare settings. Healthcare settings pose unique challenges like 1. Increased risk. Patients often have weakened immune systems, making them more susceptible. This poses a great risk towards the patients as their immune systems will not be able to fight these infections. 2. Close quarters. The close proximity of patients, especially in wards or ICUs, can facilitate droplet and direct contact transmission. This poses a great risk for both the patient and sometimes the healthcare worker and should be looked into to prevent contraction of infections. Interrupting transmission. Understanding the modes of transmission allows healthcare workers to take specific action to interrupt the spread or stop it completely. 1. Workers should regularly wash their hands using soap and warm water or use hand sanitizers. This can significantly reduce direct and indirect contact transmission. 2. Wearing gloves, masks and gowns can also protect against droplet and contact transmission from patients or from contaminated air. Keeping infected patients isolated can prevent the spread of infections to other patients. Finally, ensuring medical equipment is properly cleaned and sterilized can prevent indirect contact transmission. Foundational principles of infection control. Ensuring infection control in healthcare settings relies on a set of essential principles. These principles form the foundation for developing procedures, policies, and practices that prioritize the safety of patients, staff, and visitors. 1. Chain of infection. To control the spread of infectious diseases, it is crucial to understand the chain of infection. This chain consists of 6 links: infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible hosts. We can effectively prevent the spread by breaking any link in this chain. That is, all the agents that links the chain or that helps in spreading infectious diseases should be broken to avoid the spread of infectious diseases. 2. Risk assessment. Regularly assess and identify areas, procedures, and populations at higher risk of acquiring infection. This helps in prioritizing interventions and allocating resources effectively and pay more attention to them. Standard precautions. These are the basic level of precautions that are recommended for patient care no matter their infection or their sickness. These precautions should be taken for all patients to help them to reduce the spread of infection. 4. Transmission-based precautions. These are additional precautions used when the standard precaution alone might not prevent transmission. They are based on the mode of transmission, like contacts, droplets, and even airborne. They should quarantine the patients that are suspected to have contracted infectious diseases to avoid spread of infections. 5. Healthcare worker safety. Healthcare workers' protection is crucial. This helps in protecting the workers completely from infections. It includes ensuring they receive appropriate immunizations and training and have access to personal protective equipment. 6. Environment of care. The physical environment, including cleanliness and layouts, plays a great role in preventing infection. Regular cleaning, disinfection, and maintenance should be highly implemented. Principles of infection control. 1. Patient education. Patients and their families should receive thorough information regarding potential risk. necessary precautions, and their crucial role in preventing transmission of infections. Enlightenment in this case is very important to create awareness for both patients and their families to know what to do to avoid the spread of infection and to prevent it completely when cured. 2. Continuous monitoring and surveillance. Regularly track and monitor infection rates and trends within the facility. This helps in early detection and timely intervention. When these infections are tracked and suspected, it helps these people in charge to take care of it at its early stage and remove it completely. Importance of infection control principles in healthcare settings. Infection control principles are not mere guidelines but are vital tools. 1. Proper vulnerable populations. Many patients have compromised immune system, meaning their immune system is not strong enough to fight infection and diseases, and this makes them more susceptible to infection. Therefore, proper infection control can help save lives. 2. Prevent healthcare associated infections, HAIs. This can lead to extended hospital stays, increased cost, and even death sometimes. 3. Promote trust. Patients trust healthcare facilities to be safe. Adhering to infection control principles fosters this trust and maintains a facility's reputation. Facilities should ensure proper infection control to help patients feel confident about going to hospitals and be treated. Legal and ethical responsibility. In addition to the clear health consequences, healthcare providers have a moral and legal responsibility to avoid causing harm to their patients. Infection control principles form the foundation for all infection prevention and control measures implemented in healthcare settings. Healthcare facilities can provide a safe environment by understanding and applying these principles. Role of infection control in healthcare settings. Defining the role. Infection control goes beyond mere protocol. It is an inherent aspect of patient safety and care quality in healthcare facilities, from large hospitals to smaller outpatient clinics. Each role encompasses 1. Protecting patients. Many patients, especially those in intensive care units or undergoing surgeries, are particularly vulnerable to infections. Protecting these patients from any infection at all can go a long way in preventing infection spreads and controlling infection more. 2. Protecting healthcare workers. Healthcare workers are on the front line and at risk of both contracting infections and transmitting them. 3. Preserving antimicrobials. Effective infection control can reduce the need for antibiotics, helping to combat antibiotic resistance. 4. Preventing outbreaks. Rapid response to potential outbreaks and robust preventive measures can prevent larger crises. If these measures are taken, it can go a long way in preventing the spread of infection. Impact of effective infection control. 1. Improved patient outcomes. It reduces post-operative infections. It reduces the stay of patients in the hospital, and it also reduces the rate of deaths. 2. Workforce welfare. It reduces absenteeism due to illnesses, higher morale, and decreased turnover. 3. Economic savings. Fewer resources are spent on treating preventable infections, legal liabilities, or public relation crises. 4. Reputation. Trust in the healthcare institution is preserved, ensuring patients continue to seek care in these hospitals. Challenges in implementing infection control. Despite understanding its importance, actual implementation can face hurdles like 1. Resource constraints. High-quality disinfectants, adequate PPE, and proper patient isolation facilities may be lacking. This can reduce the chance of controlling infection and its spread. 2. Training and compliance. Ensuring all staff members, from senior doctors to janitorial staff, understand and adhere to protocols. 3. Evolving threats. New pathogens or antibiotic-resistant strains can emerge, necessitating updates in protocols. 4. Patient non-compliance. Patients may not adhere to recommended measures like hand hygiene or mask wearing consistently, and this reduces the chance of controlling infection spread. Thank you for joining this class, and I hope you learned something new. Have a nice day.